We'll quickly look at the next abbreviation which we'll be looking at. That's under chemical pathology, and this is what is known as some people abbreviate it as what 5-HIAA. 5-HIAA. Okay, the full name is 5-hydroxyindole acetic acid. 5-hydroxyindole acetic acid. So for the 5-hydroxyindole acetic acid, you could see it here. Everything is here, and a lot of things becoming another thing. You could see the 5-hydroxyindole acetic acid down here. So what is it? Okay, so the 5-hydroxyindole acetic acid, we say that it's actually the main breakdown product. That's when serotonin is broken down all the way to the last. You find the 5-hydroxyindole acetic acid. So it's produced. Okay, that's when serotonin is excreted in urine. So when you measure the levels, it's very important in diagnosing somewhat disease condition, especially the carcinoid tumors. So what is it? Origin is actually from serotonin, as serotonin is broken down by the liver by the monoamine oxidase. It will be broken down to the last step, which you find the 5-hydroxyindole acetic acid. So excretion, it will now be eliminated through urine. So a 24-hour urine collection is typically used if you want to test it. So clinical role, of course, when the levels are shooting high, it shows you that probably there's a carcinoid syndrome. You understand? So this is serotonin up to when it will be broken down to what 5-hydroxyindole acetic acid. So clinical uses, you measure it in urine because the levels in urine will determine if somebody has a carcinoid syndrome or not. You know. Okay, that's just what we got. Then monitoring treatment. Of course, as you are treating someone, you are measuring it to track. So it can also appear in malabsorption syndrome, or anything that has to do with serotonin. Though. So first consideration, dietary restriction. Before the test, the person shouldn't eat any food that is rich in serotonin. Might gives a false positive. Okay, all those bananas, walnuts, avocados, tomatoes, eggplants, pineapples might actually give some results that are elevated, but this is actually false. And some medications like antidepressants, cough syrups, you don't take them, acetaminophen, might actually also interrupt the results. So students might want to actually know the normal range. The normal range to be about 10 milligrams per 24 hours. So anything that is higher than this, you know that there's an underlying issue.